Hello and welcome. We are thrilled to have Dr. Beth Ricanati on for an interview this afternoon. And Dr. Ricanati is a women's health and wellness physician. And I'll go ahead and have you introduce yourself, Beth. Thank you again for joining us. We really appreciate your time.
Oh, I'm so excited to be here, Sarah. Thank you. So a bit about myself. I am, as Sarah said, a women's health and wellness physician. I'm currently working as an advisor across several different platforms. For example, I've been working with some startups. I've been building my own Instagram and social media platform, and I'm also incubating my own women's health and wellness ideas, specifically in the area of health and wellness in our own homes.
Lovely. So yeah, tell me a little bit about your background, education. We'd love to hear kind of where you got to where you are now.
Of course. Well, actually, when I went to medical school, I went with the purpose of going into women's health, and the wellness piece came along a bit afterwards. I trained at Columbia Presbyterian in New York City, where I then worked in their women's health center for several years until we moved back to our hometown of Ohio, Cleveland, Ohio. And then I worked in the Women's Health Center for a while at the Cleveland Clinic. And then the most wonderful thing happened, and they opened a wellness institute within the Cleveland Clinic. And I was able to move over and start up a lifestyle modification program for them. It was called Lifestyle 180, and it focused on exercise, nutrition, and stress management to treat chronic disease. And I was fortunate enough to be able to do that for several years until we moved here to California.
Lovely. So you have a great deal of experience, and it is on point, kind of with the clean living lifestyle. Our three pillars are movement, clean eating or nutrition, and mindfulness or stress reduction. So with all of your experience and all of your education, tell us kind of what your view is on where health starts, and what would you give our viewers as some tidbits on your view of health?
I love that question because I think actually I've learned over time that health really begins at home. I really strongly believe that the most impactful way we can help ourselves is to look at our homes and what we're doing inside of our homes, whether it's what we're eating, how we're moving, etc. But if we want to prevent disease and we want to treat disease, I think it begins at home. And what I think is so exciting is that not only does our health improve, physical, mental, etc., but women really run the house. We make up 70% of all decisions, and the ripple effect, that sort of multiplier effect, spreads throughout the whole family, which I think is really exciting.
Beautiful. I love how you just put it into our hands. That's really empowering. So thanks for sharing that. So with your experience, kind of on the floor of the hospital and all the clinics that you've been a part of, where did you come to this idea, or what experience brought you to this personal mission of health starts at the home?
It's been a wonderful confluence of factors, Sarah, both through my work as a clinician with women first, and then when I was running this lifestyle modification program, and I got to see really hands-on every day the effect of eating breakfast and how that affected somebody, or the effect of moving for the first time and trying to get those 10,000 steps. And then all of that coalesced at the same time as we were starting our own family, and I was having to think about what we were doing in our own home for our children. And it all kind of came together in this wonderful way. And I realized the power of what we do in our own homes has such a huge impact on our lives and those around us.
Beautiful. Thank you for sharing. So would you be willing, if your mission is health starts at the home, which I love, would you be willing to kind of walk us through the house and maybe give us a tip or two that we can apply, easy and quick things that we could do every day to increase our health by starting at home?
Absolutely. The beauty of all of this is, Sarah, that it is so simple and easy. You don't have to stress about it. You don't have to have a PhD it's very basic, and they work. So great idea. Let's do 4 rooms, 4 ideas. We'll keep it simple. I'm going to start with the bathroom. And my idea for you is to look at your toothbrush. And then I want you to change your toothbrush. The dentist least my dentist, every time I go in says, she gives me a toothbrush, change your toothbrush. And I never really thought about why, but it's actually really, really important for your health and well-being to change your toothbrush, because oral health is related to our overall health. For example, heart health. There's a correlation between the bacteria in your mouth and your risk of heart disease. And most of us don't actually even know that. So an easy way to remember, because I find I don't necessarily remember things as well as I'd like, is to change your toothbrush once a quarter. When the seasons change your toothbrush. It's really just that simple.
I love it. Super simple. And also to think about our digestion starts in our mouth.
Yeah.
So I'm sure that impacts the way that we're digesting our food as well. So change our toothbrush. Okay, what's our next room?
So let's move to the kitchen. And at least I grew up with the ubiquitous cookie jar on the counter filled with cookies. I want you to change that. I want you to think about just leaving out a platter of fresh fruit. Maybe it's apples, maybe it's oranges, bananas. I mean, obviously you can't leave out things that need to be refrigerated. But if you leave out healthy snacks, they will get eaten. There's been a ton of research in this area. It's fascinating that people who leave out things like fruit, as opposed to cereal and cookies and cake, they're healthier and they weigh less and they feel better. And it's all been documented. So it's a really simple thing. You don't need to think about it. You just put a platter out on the counter, put some fruit on it. You'll be amazed at how much you change your snacking habits and how everybody else who comes through your kitchen changes their snacking habits. And you haven't nagged anybody or yourself. It's just there.
I love that. I love that. I often say to clients, if you buy healthy food, you're going to eat healthy food. It seems so simple, but it's such a great reminder, all of these tips. Okay, so where are we going next in our house?
We're going to the bedroom. I am obsessed with getting a good night's sleep. I am stunned by how many of my patients don't sleep well, and everywhere I read now, anything, there's talk about sleep. And I think there's a direct correlation to our smartphones, our phones, and sleep. And many of us keep our phones by our bed and we keep them on. So you're getting dinged by the text or whatever. You have to get that phone away from your bed. And even if you have it on silent and it lights up, that light is distracting. I recommend that you make a docking station. And what I mean by that is you designate a place in the house where everyone is going to put their phones, pick a time, say 9 p.m. And we've chosen, for example, our kitchen, and all of our kids put their phones before bed in the kitchen to charge. I personally like that because it's an effort. If they want to go look at their phone in the middle of the night, which God willing they're not, but they're going to have to get up, get out of bed, and go to the kitchen. Nobody wants to do that. So, and then I keep mine in my bathroom. But again, it's away from the bedroom. Try it. You'll be amazed at how you feel.
Love that tip. Thank you, Beth. All right, so it looks like that would be room number 3, and we have one more left.
So family room, living room, den, etc. Leave out some books, or maybe some puzzles, or the newspapers. It's tied in a little bit with what I said with the bedroom. It's tied in with phones and iPads. If everyone's staring at a screen, you don't actually know what they're staring at. So if I might be getting all my news from my phone, and my kids don't know I'm reading news. For all they know, I'm looking at Instagram or Facebook, or I'm playing Pokemon Go right now, or whatever. But I want them, and I want everyone in the house to be mindful of what's going on around them. So we leave out a jigsaw puzzle, and we've got books everywhere, and we purposely still get a paper newspaper. I think these are really healthy habits that help connect us and ground us. And even if it's only one of them, try one of those and see what happens.
I love it. Beautiful. Beautiful way to set up easy tasks around our house, or easy ways to help us stay healthy in our home. So I love your approach. Thank you so much for sharing. So a question I have is, what health tip do you find that you are consistently telling patients? I'm sure that there are things that you feel like you're just a broken record on at points with different patients. And what would those be?
I love the line, if you've been on an airplane, right before you take off and the stewardess stands up and they give you the instructions. And one of the instructions they talk about is if in an event of an emergency and the oxygen mask falls down and you need to put that on first before you help anyone else. And I never paid attention to that until I actually had kids. But it's so great for our own health. And I think about that now a lot. If you don't take care of yourself first, you really have nothing left to take care of anybody else. So I implore my patients to really stop, put on their own oxygen mask, take care of themselves, whether that's changing how they're eating or thinking about yoga or meditation, or maybe getting a different form of exercise, whatever the individual issue is, but stopping first and putting on their own oxygen mask.
Beautiful. I love that analogy. I was just on an airplane last week, and as the stewardess was saying that, I had the same thought. Fill up your cup in order to fill up others. Self-care, that's a huge part of our clean living club or clean living mission. So where can our club members find you best? Where can they keep getting awesome information from you? Or tell us about your work and where they can find you.
Absolutely. Thanks, Sarah. I post every morning on Instagram. I post a health tip of the day. And my Instagram is just at House Calls for Wellness. And in addition, I have a website by the same name, www.housecallsforwellness, where I put up blogs, etc. So at this point, those are the two best ways to find me. And I would love your feedback and comments. Thank you.
Awesome. Yeah, I absolutely follow Beth, and her Instagram account is not only beautiful and artistic, but very inspiring. And every day she has a new simple idea to help increase your health with simple things to do around your house and in your lifestyle. So Beth, thank you so much for joining us. This information was lovely, and we really appreciate your time and your mission. So thank you so much.
My pleasure. Thank you.